Good morning. I decided to make a video in two parts. The first one, the 10 things that I wish I knew before I had gastric bypass. And the second one, the reasons why I chose gastric bypass over the gastric sleeve. So, first of all, the things that I didn't know before I had gastric bypass, the things that I wish that I did know. First, I didn't know that I would lose more than 80% of my excess body weight. I actually lost 100% of my excess body weight. I had a regain of 18 pounds due to having a tummy tuck and retaining fluid afterwards. So I regained 18 pounds, which is about 8% of my body weight, or my excess body weight. But I did lose 100% of my excess body weight. Number two, I did know that I would lose a lot of my hair, but I didn't know that I would lose 50 to 75% of my hair. When I had gastric bypass, my hair was coming out in handfuls. And that's scary when it happens. I do take a lot of biotin, and I eat 90 to 95% of my diet, if not more, is purely protein in order to get my hair to grow back. Right now, my hair comes down to here, so down to here, and the regrowth, see if I can find some. Usually it's easy to find. There you go. Is about here. And that's taken 2 years to grow back. Next month will be 2 years. So it's about half the length of the rest of my hair. And I try not to put it in a ponytail. I only wash it twice a week to avoid excess washing and shampooing. I avoid excess brushing, trying to keep it from falling out. Some of it does still fall out when I brush my hair, but not as bad as it did before. I didn't know that even 2 years after surgery, I can still only eat about 2 ounces of food. At the very, very, very most, I can eat 4 ounces. And that's only if I eat breakfast, lunch, and then for dinner, I can eat up to, at the very, very most, 4 ounces. In the morning, I can usually eat 1 to 1.5 ounces of food. And then lunch is about 2 ounces. And then dinner is between 2 and 3 ounces, sometimes 4 at the most. So about a yogurt cup at the very, very most. I had believed that by 2 years out, I would be eating a normal meal. But I still can't. I can barely eat what a 2 or a 3-year-old would eat. Excuse me, I have the hiccups. I was about, I think, 36 when I had my gastric bypass. And being 36 years old and married, the chances of getting me into a bikini are next to none. So the excess skin that I knew that I would have after a gastric bypass didn't bother me at all. So I had no intentions of ever having a tummy tuck or an abdominoplasty. It just wasn't in the cards for me. I didn't find it necessary. However, I didn't realize that the excess skin would, underneath the excess skin, I had a breakdown and it caused an infection. And that infection can lead to a staph infection, and a staph infection can lead to MRSA. And MRSA is an infection in the blood and can lead to death. And therefore, it became a medical necessity that I had to have the tummy tuck done. So I didn't know that having the gastric bypass would mean that a tummy tuck was necessary for me. I'm not saying that it's necessary for all people. I'm saying that for me, it became medically necessary that I had to have it done. And I didn't know that going into it. So it's definitely something to consider that some people absolutely, without a shadow of a doubt, have to have it done. I didn't realize that without all of the excess insulation, layers of fat, I would be cold all of the time. I used to keep my house at 68 degrees. I was always overheated. And now I keep my house at 74 degrees and wear a hoodie most of the time. I'm always, always, always cold. Even if it's 85 degrees outside, I still have to wear a hoodie in Walmart because Walmart is freezing cold. I'm always, always, always cold. Sitting is very, very painful for me because I don't have the layers of insulation and cushion around my tailbone anymore. So I can't sit more than 15 or 20 minutes at a time before I have to stand because my tailbone becomes so severely painful. My tailbone actually sits a lot lower than normal or average. So it's probably more painful than most people's would be. But mine is very, very painful for me. In the car, I have to sit on a pillow or on a folded up blanket if I travel a distance because it's very painful. And unfortunately, I live in Louisiana and everything is far away. So it's difficult. I didn't realize when I had gastric bypass that I would get to wear name brand clothes again, like I did when I was in junior high. So that's awesome. Being able to shop at Walmart or at Target and being able to fit into those clothes again are awesome. I didn't realize how many vitamins you would have to take. I do take a bariatric supplement, OptiSource, which is a over-the-counter vitamin that you can buy at Walgreens for bariatric patients. However, that still doesn't offer enough biotin, B6, B12, folic acid, iron, any of those vitamins I still have to take an additional supplement of because there's just not enough in the OptiSource. So I already have Asperger's syndrome and bipolar disorder and take medications because of those. When you add in the vitamins that I have to take on top of that, you're talking upwards of 20 pills in the morning and then again at night. It gets insane. And when you can only drink 1 to 2 ounces of fluid every 15 minutes, it's hard to get all those meds down. It's really, really hard. So I didn't realize, I thought, okay, so I have to take a vitamin for the rest of my life, no big deal, but it's a lot more detailed than that. There's a lot more involved. I didn't realize that there would be so much constipation and the necessity of a probiotic, and that's actually a two-parter. First of all, as far as the constipation, and I'm sorry to talk about downstairs issues, but from what I understand, if you have diarrhea beforehand, you will have constipation after, and vice versa. If you have constipation before, chances are you're going to have diarrhea after. And if you don't have any issues before, you're going to have constipation after. I don't know why, that's just the way that it works out. I had Crohn's disease and ulcerative colitis before surgery. So after gastric bypass, I have chronic constipation. So I was on fiber, Miralax, and Colace, and was taking those for a year and a half. And then about 2 months ago, I was told, hey, you should be taking a probiotic, and that'll help keep you regular. Well, I'm not sure why my surgeon ever told me that, but nobody ever told me that. So once I started taking a probiotic, it became a lot more regular. And then I was able to kind of taper off of the Miralax and taper off of the Colace and be able to regulate everything with just the fiber and the probiotic. Then I saw a commercial for Linzess, which is a new medication for constipation that they just came out with. So I talked to my doctor about that, and come to find out it's actually a non-formulary drug for TRICARE. So he said that there was a new an older drug called Amitiza, and he wanted to try Amitiza, and if that didn't work, then we could request Linzess, and the insurance would cover it even though it was non-formulary. So I started taking Amitiza, and it's actually working really, really well. He wanted me to come off of all of the other stuff, the fiber, the probiotic, the Miralax, and Colace, and everything else, and just take Amitiza and see if it worked, and then kind of bring everything else in one by one and see what kind of a combination I could get to work. And the Amitiza by itself does work. However, a probiotic is good for you to take, and from what I understand, every post-bariatric patient should be taking it anyway. So even though the Amitiza by itself does work, I went ahead and I worked back in the probiotic, and I'm taking the two of those together, and they're working really, really well. The great thing about Amitiza, again, TMI, sorry to talk about downstairs issues, is that it doesn't work like fiber where it's liquidy and you get that explosive urgency and like you have to go and you have to go right now. It's not like that. Amitiza makes you normal and regular, and I really, really like that. There is a little bit of an urgency, but it's not explosive. And so Amitiza works really, really well, and I really, really like Amitiza. There is some abdominal cramping that Amitiza causes for me, and that's more gas than anything, but it is working really, really well. So I'm going to continue to take that. And also, I was never told that and I was never one that drank a lot or was an alcoholic by any means. I don't drink beer or anything like that. But if I did drink, I drank alcohol, not beer, but liquor. And nobody ever told me that drinking even one shot of alcohol after gastric bypass, because you metabolize alcohol so quickly, would cause you to be drunk. Plastered drunk. It's scary, 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 scary drunk. It only lasts for about 15 minutes, again, because you metabolize it so quickly, but it causes you to be drunk. So one thing to definitely pay attention to and watch out for. Also, like I said, I was asked why I chose gastric bypass over the gastric sleeve. So the first reason was that with a gastric sleeve, you're supposed to lose 60 to 70% of your excess body weight, and with a gastric bypass, you're supposed to lose 70 to 80% of your excess body weight, and 80% sounds a lot better to me than 60%. So I would rather have gastric bypass. Also, I had hypertension and diabetes prior to having gastric bypass. And even though it's not a guarantee, gastric bypass is the only known cure for diabetes and hypertension. I was one of the lucky ones, and the day after I had gastric bypass, I was able to come off of all of my diabetes and hypertension meds and had zero symptoms. 3 months after having gastric bypass, I was pronounced medically no longer hypertensive or diabetic. So that's amazing to me. And that was the biggest reason why I chose gastric bypass. The third reason is that I actually wanted dumping syndrome. I had an addiction to sugary foods. I had an addiction to fatty and greasy foods. Isn't that the reason that I was 333 pounds? I wanted a deterrent from those types of foods. Unfortunately, I never got dumping syndrome. The only thing that ever caused me dumping syndrome was lactose. And I became lactose intolerant after having gastric bypass. And on a sidebar, in order to overcome that, I started drinking just like a quarter of a fluid ounce of organic milk per day, and then a half ounce, and then an ounce, and then an ounce and a half. And I kept increasing that until I could drink a full cup of organic milk every day, so I can now process lactose again. But after gastric bypass, I couldn't have lactose at all. But sugary foods, fatty foods, greasy foods, none of those caused me dumping syndrome at all. So as far as that goes, the gastric bypass didn't help. But those are the reasons that I had gastric bypass, chose that over the gastric sleeve. And the other reason, I think that people, from the first surgeon that I saw told me that you can have a gastric sleeve and then save the big guns for when you really need them. So you have the gastric sleeve, and then if it doesn't work, you later have a gastric bypass. And that just seemed a little bit odd to me, that you have a gastric sleeve waiting to fail and then have a gastric bypass later, when instead you can have a gastric bypass now, knowing that that would work, and just get it done with now. And I guess that maybe another rule of thumb would be that maybe it isn't necessary right away. I'm not sure. Maybe that's what he was thinking. I don't know. But that didn't sound right to me when he said it. So that's why I chose a gastric bypass over a gastric sleeve. So those are my reasons. I hope that everybody has a wonderful day. If you have any questions, please leave them in the comments below. Subscribe. Have a wonderful day. Take care. Bye.